To become licensed as a pharmacist in California, an applicant must pass two exams, the NAPLEX and the CPJE. So what is unique about the CPJE? So although the CPJE is considered a law exam, the majority of the questions do test clinical knowledge. So they're going to test evidence-based pharmacotherapy decisions. They're going to want you to perform therapeutic monitoring and develop therapeutic regimens. They're also going to have you test the knowledge that you have on clinical practice standards. For example, they want you to demonstrate knowledge that you would demonstrate on your clinicals, like can you assess a patient, can you perform patient counseling appropriately without looking it up in your Palm Pilot, on the fly. And let's see, so some more reminders for the CPJE are the format. The CPJE, it is a 2-hour exam. It is 90 multiple choice questions. Of the 90 questions, 75 questions do count toward your score. The other 15 questions are pre-test questions that will be evaluated for inclusion on future examinations. The pre-test questions are distributed throughout the exam and they don't affect the score. You are unable to change an answer once you have submitted your response and you have moved on to the next question. Your score on the exam is based on the number of correct answers, obviously, so it is to your advantage to select an answer for every question, and there is no penalty for guessing. CPJE scores will be mailed to the applicant's address of record about 30 days after the exam. The board occasionally will conduct a quality assurance, a QA assessment, to ensure that the exam questions are appropriate. Your score may be delayed for any applicant that was testing during a QA period. Let me see what else we have here. There are obviously several different manuals that you can use and sources for practice questions. So any information that you learned in pharmacy school is fair game and can be tested on both the NAPLEX and the CPJE. This includes calculations, flow rates, creatinine clearance, compound calculations, compounding calculations. Information in these topics may be especially important, such as infectious disease, HIV, immunizations, med safety and quality improvement, acute and critical care medicine, and learning IV medications, mastering brand and generic names, top-selling drugs, and definitely visit different Q banks and do practice questions. That is a strong recommendation. For the questions you get wrong, obviously you want to really read through why all of the wrong answers are wrong and the rationale for why the right answers are right. And let's see, there are different manuals that cover more of the California law content for CPJE versus the what I've already taken for another state many years ago. The I believe it's the MPJE was what we took. That one was a lot less clinical. Back then in 2007, it was all law really, so I'm expecting this test, from what I've heard, to be a lot more clinical and a lot harder than the law test that I've taken for the multi-state jurisprudence exam. And so consult different manuals that will help you prep for the CPJE on the clinical topics that are important for application of law and clinical. And what else do we have noted here? Some of the manuals may cover the clinical topics that might include pharmacist provided clinical services that might be authorized under California law, and drug formularies, therapeutic interchanges. They may be part of the medication utilization evaluation that is performed. And they definitely said that they recommend taking the CPJE, obviously if you are a new grad, no later than 2 to 4 weeks after you took the NAPLEX, in order to retain drug information that you reviewed while you were prepping for your NAPLEX. Some students will take the CPJE first due to scheduling conflicts, and that's also fine. What else do we have here? In terms of supplemental resources, there is a California Pharmacy Law Book that includes pharmacy-related regulations from the BNPC, which is the Business and Professions Code, the California Code of Regulations, the CCR, and the Health and Safety Codes, H&SC. There's key regulations that are cited throughout the manual that can serve as references. There are some board newsletters called The Script that you could review. There's the Community Pharmacy and Hospital Outpatient Pharmacy Self-Assessment Form that could be reviewed as a supplemental resource. And then there's also some self-assessment forms that are completed by pharmacists in charge for every California licensed pharmacy every odd number year. And these forms, these self-assessment forms, are developed by the California State Board of Pharmacy as tools to ensure that the pharmacies are following all of the legal requirements for their operations. There's also compounding self-assessment forms, which are helpful for the exam. Items from the self-assessment forms are reviewed in this manual and tested in the CPJE QBank. Pharmacy law changes happen frequently, and so before sitting for this exam, you can also check on the California State Board of Pharmacy website for any updates. Let's see. In terms of the content outline for the CPJE is roughly divided into 3 areas. About 23 items, or 31% of the scored questions, is on patient information and prescription evaluation. Then the next component is about 27 excuse me 27 items, or 36% of the scored questions, is going to be on clinical practice. Again, clinical, this area will cover clinical content such as therapeutic regimens, performing, monitoring, resolving problems like adverse drug events, drug interactions, initiating pharmacist provider therapies. It also includes content on educating patients and healthcare professionals. Let's see. The last section, about 25 items, or 33% of the scored questions, will be on pharmacy operations. So, how to prepare for this exam: use your time wisely, create a study plan. Remember, any content in the UWorld and RX prep materials, you know, is pretty good. A lot of students have used it. I remember back in 2007, I also used the Kaplan books for test prep, and our company then also paid for our board review. So we had like a couple days of board review for NAPLEX that they paid for us to all go to as new grads. So yeah, we used the Kaplan then, and I'm also hearing something about another program. Trying to think of what it's called. I think it's called PNN, like Past NAPLEX Now. So there's a whole bunch of different tutors and review courses and different things. You can even go to the library and rent some of the different review books that are available if you don't want to purchase them or find a tutor. And let's see, so again, use your time wisely. Any content can be tested once again on the NAPLEX or the CPJE. You want to review brand and generic names of the top selling drugs. Make sure that you know the indications and the common safety issues. Practice reviewing patient profiles. Decide if the drug to be dispensed is safe and appropriate for the patient. Make sure you are well prepared. Don't test until you have read through some of the review manuals and reviewed some of the self-assessment forms for community pharmacy, hospital pharmacy, and compounding at a minimum. Pretend that you are the pharmacist in charge and then complete those self-assessment forms. Review any of the PSI candidate bulletin information bulletins and practice questions for the CPJE on the PSI candidate information bulletins. Review necessary clinical content from the different test banks that you might be able to find online and buy a subscription to. And after you've scored well on some of these different practice exams and Q banks, then you would want to schedule your test accordingly. Good luck.